I'm going to talk about the cardiovascular system, aka the circulatory system, which includes the heart, blood, and blood vessels. Blood vessels are arteries, capillaries, and veins. The heart is a muscular organ with 4 chambers, 2 upper atria, and 2 lower ventricles. This is the right atrium, and this is the left atrium. This is the right ventricle, and this is the left ventricle. The heart also has one-way valves, the tricuspid, the mitral, which is also referred to as the bicuspid, and the aortic valve. Now, veins return blood to the heart, and they usually return oxygen-poor blood. However, the pulmonary veins are the exception to this. They return oxygen-rich blood. So all veins return blood to the heart, and most return oxygen-poor blood. The pulmonary veins are the exception. Arteries carry blood away from the heart, and they usually carry away oxygen-rich blood. However, the pulmonary arteries are the exception to this. They carry away oxygen-poor blood. So all arteries carry blood away from the heart. Most carry oxygen-rich blood, with the exception of the pulmonary arteries. I'm going to point out some important veins and arteries of the heart. This is the superior portion of the vena cava, and this is the inferior portion. These are the pulmonary veins, and this is the aorta, the largest artery in the body. And these are the pulmonary arteries. And also important to note is that coronary arteries are what supply the heart muscle. So coronary arteries are specifically the kind of arteries that supply the heart muscle. I'm going to go through blood flow of the heart, and I'm going to use blue to denote oxygen-poor blood because it's been circulating in the body and it's dropped off oxygen and nutrients and picked up waste. And I'm going to use red to denote oxygen-rich blood because of gas exchanges with the pulmonary system. So oxygen-poor blood is returned to the heart via a vein, the vena cava, and enters into the right atrium, which contracts and sends the blood into the right ventricle, which contracts and sends the blood out of the pulmonary arteries to the lungs. Blood, oxygen-rich blood, returns to the heart via the pulmonary veins and enters into the left atrium, which contracts and sends the blood to the left ventricle, which contracts, sends it out of the aorta and back to the body. Systolic blood pressure is the pressure created when the heart contracts and forces blood into the arteries. Diastolic blood pressure is the pressure that remains in the arteries when the left ventricle is relaxed and refilling. And blood pressure readings are given as systolic over diastolic. Stroke volume is the amount of blood ejected per contraction, and it depends on 3 things: preload, contractility, and afterload. Preload is how much the heart is filled from return blood prior to contraction. The greater the preload, the higher the stroke volume. So think about this. For example, if the heart is only returned a little bit, or blood is only returned to the heart a little bit, then its stroke volume is going to be low. There's not a lot of blood to push out per contraction. Contractility, the force of contraction, and afterload. Afterload is how much pressure the heart has to pump against to force blood out. The greater the afterload, the lower the stroke volume. So again, say there's a lot of pressure that the heart has to pump against to get that blood out. Well, that's going to make it difficult to get the blood out, so it's not going to get that much blood out. So the greater the preload, the higher the stroke volume. So the more blood that's returned in there, the more is ejected out. And the greater the afterload, the lower the stroke volume. So the more pressure it has to pump against, the less it gets out. We'll talk about the other components of the circulatory system, blood and blood vessels. Plasma is the suspension that these other components are in. Erythrocytes are red blood cells. Erythrocytes carry oxygen to tissue and carbon dioxide away from it. Leukocytes, aka white blood cells, are involved in immune functions. And platelets have clotting factors that help the blood clot. Blood vessels includes arteries, capillaries, and veins. And as I discussed earlier, arteries carry blood away from the heart. Arterioles are the smallest kind of arteries. Veins return blood to the heart, and venules are the smallest kind of veins. And these capillaries right here are small blood vessels where gases, nutrients, and waste is exchanged between the cells and the bloodstream. And that concludes this video on the cardiovascular system, aka the circulatory system.